Hi everyone, this is Dr. B Yapping. In this video, we are going to talk about money. And not just about money, but those surgical specialties where people make the most amount of money legally. We will talk about different doctors, how they do what they do, and how much they take home for everything they do. Entering an operating room requires a rare mix of steady hands, nerves of steel, and over a decade of brutal, sleep deprived training. For most doctors, surgery is a calling driven by a desire to save human lives. But let's not pretend money isn't part of the conversation. In the high stakes realm of medicine, not all scalpels are created equal. While an average general surgeon earns a comfortable living, there exists an elite tier of surgical specialists who command staggering seven-figure fortunes every single year. What does it take to join this ultra wealthy medical club? What do these doctors actually do inside the OR when millions of dollars are on the line? Today, we are opening the financial ledger of medicine to rank the top 5 highest paid surgical specialties on earth, from six figure salaries to the coveted $1 million scalpel. Starting off our countdown at number 5 is the specialty where a single millimeter mistake means game over in seconds: cardiothoracic surgery. What they do? Cardiothoracic surgeons operate on the body's primary engine, the heart, lungs, esophagus, and major blood vessels inside the chest cavity. They perform high stress marathon procedures like coronary artery bypass, heart valve replacements, lung transplant, and the repairs of fatal aortic aneurysms. In many cases, they literally stop a patient's heart, redirect their blood through a heart lung bypass machine, fix the organ, and restart the beat with their own hand. On average, they take away $650,000 to $800,000 every year, while the top 10% of them earn over a $1.1 million paycheck every year doing what they do. Why do they earn this much? The sheer physical and emotional toll is immense. A single emergency aortic dissection call at 3 a.m. can lead to an 8-hour surgery where the patient's life hangs by a thread every second. High risk, high stakes, and for that, sky high compensation. Moving up to number 4, we enter a realm of medicine so delicate that surgeons work under powerful surgical microscopes operating on organs no bigger than a golf ball. Pediatric specialized surgery, specifically focusing on pediatric neurosurgery and congenital heart surgery. These specialists repair complex birth defects, brain tumors, and structural heart flaws in infants, toddlers, and young children. Operating on an adult brain is tough. Operating on a newborn baby's brain or repairing a heart the size of a walnut requires precision beyond human belief. They reroute microscopic arteries and delicately remove tumors from tissues so fragile a slight touch could cause permanent paralysis or death. For all of these things, on average, they make around $700,000 to $850,000 a year, and top 10 earners among them make more than $1.2 million a year. Why they earn it? Because the supply of these specialists is ridiculously low, and the training takes up to 16 years after high school. Furthermore, malpractices risks and emotional pressure when dealing with sick children make this one of the most demanding jobs in human history. At number 3, we step away from life or death emergencies and step straight into the multi-billion-dollar empire of human beauty, plastic and reconstructive surgery. Plastic surgery is split into two worlds: reconstructive surgery, where fixing severe facial trauma, burn injuries, or post cancer tissue repair is done, and aesthetics, where facelifts, rhinoplasties, breast augmentations, and body sculpting is done. While reconstructive work is covered by insurance, cosmetic procedures are paid 100% out of pocket by wealthy patients upfront. While hospitals pay these surgeons from $550,000 to $700,000 a year, their private practice can make them up to $3.5 million dollars a year. Plastic surgeons who run successful private cash only practices dodge the headache of dealing with health insurance companies entirely. By combining elite surgical skill with high end branding, celebrity clientele, and premium pricing, top plastic surgeons in places like Beverly Hills, New York, or London can easily out earn almost every other doctor on this list. Taking the number 2 spot is a discipline that operates on the master column of the human body: orthopedic spine surgery. What they do? While general orthopedic surgeons fix broken bones and replace hips or knees, spine surgeons deal exclusively with the complex column of bones, discs, and delicate nerve roots that support your entire torso. They perform spinal fusions, artificial disc replacements, scoliosis correction, and complex reconstructive surgery for patients suffering from crippling pain, trauma, or paralysis. On average, they make from $750,000 to $950,000 a year, while the top 10 earners in the field can make to more than $1.8 million dollars annually. Why they earn it? Hardware and demand. Spine procedures frequently require complex, expensive titanium implants, hardware, and specialized surgical technology. Because spine surgery carries a high risk of permanent nerve damage or paralysis if something goes wrong, the skill required and the financial compensation attached to it is staggering. The number one specialty on the list is the absolute, undisputed crown jewel of medical compensation: the surgical specialty where doctors operate on the very essence of human consciousness, memory, and identity: neurological surgery or neurosurgery. Neurosurgeons diagnose and surgically treat disorders of the central and peripheral nervous system, including brain aneurysms, massive cranial trauma, deep brain tumors, and intricate vascular malformations. A neurosurgeon's workspace is measured in fractions of a millimeter, one slip of a microscopic tool inside the brainstem, and the patient may never wake up again. While providing all these services, these doctors make from $800,000 to $1.1 million dollars annually on average, while the top earners and department heads can make from $2.5 million dollars to $5 million plus dollars annually doing what they do. Neurosurgery requires one of the longest, most brutal training pathways in all of medicine. 7 years of residency alone after medical school, often followed by specialized fellowships. Their call schedules are notorious. Procedure times can stretch past 14 hours for a single brain tumor, and they shoulder the ultimate medical responsibility: preserving the human brain. While these salaries sound astronomical, every dollar earned represents thousands of hours of sacrifice, immense personal risk, and years spent mastering the most complex machine in the universe: the human body. Which of these surgical specialties surprised you the most? Would you ever undergo 15 years of training for $1 million scalpel? Let us know in the comments below. Don't forget to like, subscribe, and hit the notification bell for more fascinating deep dives into the medical world. Until next time, stay curious.